Hello, I'm Leanne Barclay. I'm the clinical nurse specialist at Dunedin Hospital, and I want to talk to you about your recovery after heart surgery. When you go home, you're not going to be on your own because we will refer you to your local district nurses. They will come and see you and they'll assess you and they'll tell you what their plan is going to be. They will look after your wounds and take out maybe a couple of sutures that need to be removed at around about day 10. The other person you need to see is your own GP, and we want you to do that within the first week of going home so that your GP can have a bit of a look at you and gets a feel for how you are when you're discharged from hospital. Your GP is the person who will be looking after you when you are discharged, so you need to let your GP know if you have any issues. So these would be things like a high temperature, new signs of swelling, redness or discharge from your wounds, unusual breathlessness at rest, or if you have a rapid heart rate. Of course, at any time if you're feeling very unwell and you can't wait to see your GP, we would ask that you ring for an ambulance and get seen at your local hospital or clinic. We will give you a discharge summary, and it has all this information on it that goes through to your GP. Your GP gets that discharge summary electronically. But what's really useful for you is that it has a list of your medicines on it. Now, we want you to keep taking those medicines as prescribed until told otherwise by your GP, your cardiologist or your surgeon. So you may have to go back to see your GP to get further prescription for those medicines. So keep taking them. Now, you are in charge of your own pain medicine. So when you go home, you can still expect to have some discomfort in your chest, shoulders and back as things heal up. It's going to take around about 6 weeks for your heart to heal, but it's going to take 3 months for this breastbone to heal. And as it heals, you might get different aches and pains. So keep taking your pain medicines. It's my suggestion that you keep taking your paracetamol tablets. Most people take 2 paracetamol tablets 4 times a day for the first week or 2 when they go home. So the way you would do it is to take 2 paracetamol at each meal time and then 2 at bedtime. So breakfast, lunch, tea, bedtime. That's the way to do it. Then wean yourself down with these medicines. After the first week, you usually can go down to twice a day, and then another week or 2 later, just once a day. But we leave that up to you. And if you are a bit confused about that, you remember to talk to your GP or your district nurses, and they can give you advice. We want you to look after yourself when you go home. So that means you have to eat a good, healthy diet. You're going to have some increased needs for a little while when you go home with your diet, and oftentimes your appetite goes off. So protein is good, meat is good, red meat is good at this stage because it's got a bit of iron in it, which will help boost up the red blood cells. We tend to run you a little bit low with the red blood cells at first. But meat, protein contains the building blocks for your body, and it's going to help mend and repair the damaged tissue. You need to eat lots of vegetables and fruit, so eat a wide variety of colours every day if you can. And you need calcium-rich foods to mend the sternum, so milk, milkshakes and yogurt are really important. It's important that you get adequate rest when you go home, and you might find that you have some trouble sleeping, and that is not uncommon. We want you to try and sleep in the bed because we want you to get back into normal sorts of habits, and I know sometimes you sleep upright in a lazy boy style chair when you're in hospital. We want to encourage you to get back into your normal routines as best you can when you go home. You may find that you're a bit wakeful through the night, so you're probably best just to get up and have a warm drink and then go back to bed when you're feeling sleepy. You may sleep in whatever position is comfortable for you. So if you wish to sleep on your side and you can do so, that would be absolutely fine. It's very common to have funny, peculiar dreams after the surgery, so don't be too bothered by them. They should go away in a week or so. Some people even have hallucinations in the first few days after their operation, and again, these should go away pretty soon. It's caused by a number of factors, and it might be partly the medicines, but also sometimes you get a bit of fluid in around your eyes. And so you may be experiencing some visual disturbances, sort of fuzzy vision and things like that. So don't get your glasses changed. If you wear specs, don't get them changed for a month or 2 afterwards, just until everything settles back to normal. We want you to keep up with your exercise, and hopefully the physios have gone over this with you, but you should be going home with a book called The Road to Recovery, which has your exercise plan in it. And so keep doing the exercise, even if you're feeling a wee bit tired. Still try and do something every day. Little and often is a good way to start. Walking on the flat is good. And if you've got an exercycle at home, that's a really good one to use. These things help you to recover faster. They're good for your lungs, to get your lungs working better. So you should feel better in time. Getting back to normal just takes a little bit of time, and so getting back to driving is usually around about 4 weeks after the surgery. We don't want you driving at first because you do tend to feel pretty tired and your memory and concentration are not good, and so you're really not a good driver out on the road. You do, however, need to wear your seatbelt in the car, and you should have got a little red cushion or a pink cushion to take away with you. I think I've got some up there. Some little cushions to take home, and they're good between you and your seatbelt, and you're able to do that. Going back to work does depend on the work that you do, and so if it's a heavy physical sort of job, then it's going to be a bit longer before you go back to work, usually around about 3 months. But light office work is around about 6 weeks' time. It is normal to feel a bit stressed after surgery, and that's just a normal reaction to this abnormal situation that you're in. So realise it's just part of getting over the surgery, and don't be too hard on yourself. You might find that you have some good days and some bad days. Don't overdo it on the good days. You want to have a nice steady progress in your recovery, and just follow the guidelines that you've been given by the nurses and the doctors and the physiotherapists while you've been in hospital, and you should start to come right. Cardiac rehab helps you get over the surgery. Unfortunately, at the moment, with the lockdown sort of things that we're doing and COVID-19, we can't offer you all the usual cardiac rehab programs, so you have to do the best you can at home. But no doubt some nurses will be phoning you and finding out how you're getting on when you're at home. So if you have any problems, you've probably got some phone numbers that you can reach out with. Certainly talk to your GP and talk to your district nurses. So that's about it. I wish you very well for your recovery. Stay well, and I'm sure you're going to do okay.